I'm currently running a research study investigating a new software tool which identifies people at risk of heart disease and stroke, and we've installed this into 19 practices in Coventry and Warwickshire, and that trial is ongoing. When we first developed the software 2 to 3 years ago, we included in it a little module that picks up people with possible undiagnosed diabetes, and we found when we installed the software in all the practices that a number of patients were identified in this category. The number of patients in each practice isn't very large, but when you add it all up, it becomes a significant number of people, and we wondered whether this was a local issue or whether in fact it applied nationally to all practices. We know that in the UK there are believed to be about 600,000 people with undiagnosed diabetes, so it's a large number. Now, these are people who may have no symptoms at all, or they may just have mild symptoms that are often put down to ageing. They feel tired, lethargic, they perhaps are getting up to go to the loo at night, the sort of things that people just easily sort of pass off, but in fact may be due to diabetes. So I then approached colleagues at EMIS, who are the clinical software company that I'm working with, and Julia Hippersley-Cox in the University of Nottingham. We also involved Azim Majid from Imperial College in London, and we decided to run a search all over the UK on 3.6 million records that are linked to the Q Research database in Nottingham. The software examines the electronic records of everyone in the practice. It identifies people who've had a blood glucose measurement taken at some time in the past. It looks for the most recent reading, and it tries to identify people who are not on the diabetes register. In other words, they're not known to have diabetes to the practice, but who have a level that is within a certain range.
Do you mind if I just take your blood pressure? A lot of patients come in and they have multiple problems, and obviously only have a 10-minute consultation with them, and their priority may be different to our priority, so therefore we can deal with their problem but also be aware that there is an outstanding problem that we need to look at. Software means is great because it's put onto an alert, so when we see the patient and open up the consultation page, it's there for us to see straight away.
We actually identify 2 different categories of patient. In the first category, the level is high enough to suggest diabetes, although unless the patient has obvious symptoms, it would need repeating again to confirm that they have diabetes, but nevertheless it's very likely that these people have diabetes. The other category are people who have more borderline levels, but nevertheless still levels that justify another test to be certain that they don't have diabetes, and of course there are a lot more of those patients. It's important that these people are identified and treated effectively to stop the diabetes from causing damage to the various organs like the kidneys, the eyes, the heart, the feet. When I was originally developing this idea, I ran a search in my own practice to identify patients who might have undiagnosed diabetes, and I found about 6 patients who were in this high-risk category. One of them was Peter, who I invited in to have his diabetes status clarified.
I got a call to come into the surgery in Kenilworth to see Dr. Tim Holt regarding some possible problems on the blood result. So I came in, and obviously I was diagnosed, not immediately, but diagnosed that there is a possibility for diabetes, but to be sure I had to undergo further blood tests just to make sure that the diagnosis was absolutely concrete. And so I came back and I was told yes, I did have diabetes, and my first reaction was I was obviously surprised, but not only surprised but a bit angry with myself, because I said, why me, you know, because I normally thought I was a fit person, and why should I have it, especially when I don't have any symptoms. And I was asked by Dr. Holt whether I feel that or have that symptoms. I couldn't feel anything other than at night I had to get up several times to the toilet. Part of that I was okay, because I had also high blood pressure and obviously diabetes, that I should start immediately treatment. There's no ifs and buts, I just change immediately. I ate differently, I ate smaller in terms of volumes, I ate more regularly, and I stopped eating late. The only way to get back to normal my glucose level and the systems is to reduce weight drastically. So I've managed to reduce weight from about when I was diagnosed, I was 16 stone, 105 kilo, and I'm down now to 12.
Projecting the figures that we found in our study to the whole population of the United Kingdom, that there are probably 60,000 people identified in the higher risk category, and that's 10% of the missing population. So that's a significant proportion. We don't know for certain that all those people have diabetes, but it's likely for that higher risk category that a lot of them do.
Using this software, we can pick up so many more patients and catch them early before there's more serious problems associated with the disease.
I think the key to all that is one, obviously being diagnosed early enough. Thanks to Dr. Hall's software, I think it did help me.
As an academic, it's obviously very exciting to think that this same approach could be used all over the UK to help people in similar situations, and indeed all over the world.